to be critical, but just trying to really understand, here's what we need to make better. And then we had your friend and mine, Dr. Christina Chambreau, Jeff. I've known Christina for many, many decades. And I first should apologize. I have a little bit of a cold today, so excuse my coughing. Christina talked about trusting yourself when it comes to your healthcare choices for your animals, that there's no wrong answers. You just have to follow your nose, so to speak. She didn't say that, but that's what I say. Follow your intuition and follow your nose. And those choices will come, those answers will come to you if you just allow yourself to really tune into your animal and then trust yourself. Then we had my dear friend Ihor Basco. And I just want to do a shout out to Ihor and his family in Ukraine. He's getting text messages from his 24-year-old niece who's in some sort of a basement bunker. So our hearts and our prayers, our thoughts go out to Ihor's family in Ukraine. And he and I talked about the overuse of drugs and really using food as medicine. He's an expert in Chinese medicine and food therapy. So we had two people on actually that are experts in food therapy, Judy Morgan and also Ihor Basco. And then we're going to have somebody else later on too, Dr. Cheryl Swartz. And then we had dear Odette Suter, and Dr. Suter talked about the pillars of health. I think those were 7 pillars of health that all kind of dovetail with each other, feed onto each other, and support each other in their overall health. She also talked about kind of the biggest mistakes and the kind of brainwashing that can occur when you're not really, listening to yourself. And then, of course, Jeff. We talked about a lot of things, and I thought maybe we would go over some of those a little bit, get in a little more detail, and then we'll open it up for questions. But the other people that we had on are Melissa Boland and Angela Koppel, and they're the owners of Four Legger Pet Shampoos. And I love these gals. They're I can shamelessly plug them because I love their products. I love what they're trying to do. They are really trying to revolutionize pet grooming products. We sell a lot of them on our store and in our clinic. They have an incredible database too. It's called Pet Shampoo Ingredient Database. And that database, you can plug in any ingredient in there and it'll tell you if it's toxic, if it's safe, if it's green. So because they're our gold sponsor, I really wanted to shamelessly plug them. But it's easy for me to do because, I know them and they're fabulous women. So I like people like that who are making the planet better for one dog, one cat, one community at a time. So anyway, without further ado, Jeff, why don't we go into a little bit more detail in my conversation with you on this idea of One Health medicine. It's, I did a little introduction video, and in that process, I don't know if you saw it, Jeff, but it was a little 10-minute introduction when people signed up. And I thought of you and One Health, and I looked at the CDC website on One Health, and really it's one disease, right? And it's like, oh my gosh, and if we always have that kind of and of course, the animals are responsible for every disease imaginable. And so no responsibility on our part, but your idea, and like so many holistic practitioners about, we really need to remember that we're all one. We are one with our family members, our dogs, our cats, our community, our cities, our planet, Let's talk about that a little bit, because I think the concepts are beautiful and you really share them a lot and quite eloquently. You want to dig in?
I'm honored. Yeah, and thank you so much for having me, Dr. Lee. It's just awesome to be here, and your speakers today have been just amazing. So Thank you, thank you, thank you. And One Health medicine is a little bit of a spin on One Health because, as you said, One Health has become all about disease and
Mm-hmm.
all about focusing on the germ. And One Health medicine is all about focusing on balance, focusing on the terrain, what's called the terrain, which is the basically the parts of the body that allow us to remain balanced and which also allow the body to our pets' bodies to heal at their maximal potential. And that may be part of an important part of the One Health medicine paradigm is what we're calling the regrowth mindset. The psychologist Carol Dweck has a fixed mindset, which is One Health, and symptoms and diseases all put you into a fixed mindset, and we're in a regrowth mindset or growth mindset, which is what she calls it, as far as knowing that the body is able to heal, knowing that it's really about getting out of the way and letting your pets do what they're able to do naturally.
And don't you think, though, that that's a whole lot easier for them to do, for us to do, if we're not what I call encumbered, if we're not loaded with toxins, if we're not stressed all the time, if we're not, if we're getting proper nutrition, proper exercise, fresh air, good water, not polypharmacy water. you know, it's difficult for the body to heal if it's I always think of it as like somebody trying to carry around a bag of rocks. It's hard, it's hard to heal when you're, in that kind of a place. And so, but it's interesting that you mentioned the one growth, because I want to take that deeper, that idea. I want to take that sort of almost at a spiritual level, because part of what happens, I think, is that we always has in this country anyway, there's this philosophy about growth. The economy has to grow, our cities have to grow, everything has to grow, which is really a cancer modality, you know. Excuse me. So how do we understand that everything has a growth cycle? It has a rest cycle. We have a growth cycle, we have a rest cycle. And we're so far out of balance in that regard, the seasonality, the cycles of our lives, cycle of food, where, we demand those blueberries in the middle of winter, we demand these kinds of things. Don't you think that we have to really look at that imbalance too of the growth cycle?
Exactly, and that the regrowth mindset is the same mindset really of regenerative farming.
Beautiful. Okay.
And that is exactly what you just said, is that we need to live in accord with nature. We need to follow the cues of nature, because when we do, we're able to get out of our pets' ways. So interfering with nature, well, we kind of know what that ends up with. And ending interfering with the functioning of the body
Mm-hmm.
also can wind up in worsening um, problems. I just spoke today with 3 holistic actions student supporters, and all of their pets had cancer.
Yep. Yep.
And yet we all have cancer. They all have cancer cells in our bodies,
Mm-hmm.
but when our immune systems are doing their job, it's no biggie.
Right. Right. It is no biggie. But when the immune system, when the vital force, when the whole body is again encumbered, just too much to deal with. Too much to deal with. There's just no possible way on this planet that you're going to be able to fend off and fight off those things that normally just would be dealt with in a New York minute.
Exactly.
So the idea of One Health too, it's a global idea, right? I mean, You might want to explain a little bit about regenerative farming, because some people might not know that. And that is applicable here, what we're talking about, because without, we have problems with big pharma and problems with big food and big ag and the biggies. Those are the three biggies. And they have really corrupted our food sources, our medical system, our soils and land. We're losing topsoils. So the idea of regenerative farming is a beautiful, beautiful model, and it's working. Tell people about what that is, because it's an exciting thing to know about.
Well, I think that both focusing on regeneration internally and regeneration of the land, or regenerative farming, are the same thing, in that
Yeah.
we're nurturing the soil. We're making sure the soil has what the plants need to be as disease resistant and as healthy as possible. And I think the original model, all we have to do is look back at all the indigenous people
Mm-hmm.
in the world. They all followed the regenerative farming model, in that they're working with nature. They're not, they're not overgrazing land. They're not doing all the things that big pharma and big agriculture all do, and which we're now getting away from, which, as you said, is awesome, awesome, because we're going in the right direction.
Yeah. Yeah, I think so too. I mean, it's so as veterinarians, we were taught large animal medicine too. And so those principles, I always think about them, because even though I don't practice large animal medicine anymore, I haven't for many years, I think what's really important is that veterinarians are really at the forefront, can be at the forefront for a lot of these kind of changes. And I know many of our contemporaries have been involved in these kinds of techniques, I could say. Thank goodness, because I think we understand it from the medical point, like what you were just talking about, and the micro and the macro. I love it. I love it.
Exactly.
Yeah. So there was something else I was going to ask you. Did you want to mention anything before we
I
go to
actually
questions?
did, and
Okay, good.
that is something that we may have touched on the talks a little bit, and that is, we're looking at what's called the terrain theory,
Mm-hmm.
which is the terrain both inside the body and outside the body, but it's opposed to terrain theory on one hand and the germ theory on the other. That
Mm-hmm.
is, that the germ is the cause of everything,
Mm-hmm.
versus the terrain, what you do to yourself, what you do to your body, what you do to your pet's body, doesn't have any bearing on if you're exposed to a toxin or germ or something that could be harmful. When the opposite is actually true, there are tales that even Louis Pasteur, the founder of the germ theory, said, it's all about the terrain
Yeah.
at the end of his life.
Yeah, that's what I've heard many times. And he was not even a doctor. He was a chemist, and somehow or another his ideas kind of usurped the physicians of the time, Beauchamp and what's the other name of the other gentleman? Another big name. But anyway, they were terrain theory doctors. And they always
Bernard.
said, thank you, Bernard. And they always said, this is what's more important is the overall health and vitality of the person. It's not the germ. And this has been actually shown over and over and over again.
It's not a question anymore, and anymore in science. We're talking about all of the issues we're talking about today are in the past 120 years, because the terrain theory and the balance theory has been around for thousands of years. This is the basis of all societies that rely or that understand the vital force of the vitality of the individual, that we're all fueled by, some sort of seen or unseen energy that when we foster it and get out of its way, it does what is the best thing for the body at that time.
Mm-hmm. And I always find, talk about terrain. I got myself overstressed, overextended, and then went to a conference and traveled in horrific conditions and was in horrible wind and cold and snow and exhaustion and, the whole thing. And of course, because, these things happen like this. So, of course, I came down, with something. But I know normally, I just pass it off in a day and it's no big deal. But I was already exhausted, and I was already depleted. And otherwise, I have a pretty good vital force and I can rally fairly quickly. Not that I'm perfect, nobody is. I have plenty of chronic disease. But so this one kind of hit me a little bit harder. But I know exactly what set it up. I know the lineup of all the things. And it's pretty predictable, even in our animals. We can watch that too. If we do a good medical history, you can watch how their chronic disease just, I always ask my clients, well, what happened before this occurred? There's almost always something that the pet parent knows. Here's what happened. They got this, they got that, we introduced a new animal, they got vaccinated, blah, blah, blah. Anyway.
I'm sorry to interrupt, but I'm going to forget this. Did Christina talk about the early warning signs of imbalance?
I don't remember that she did. She might have. Go ahead.
Because your pet's bodies will give you clues to what's going on internally. The diagnostic tests may be all normal, but you know your animals best. And there are subtle changes in behavior and energy and appetite and mood that can signal a little bit of an imbalance internally that can be rectified before it progresses to some sort of, disease, per se, diagnosable disease.
Yeah, exactly. Catching everything early is always a good idea. Shall we answer a few little questions?
Whatever
I don't mean little. There's important questions, whatever it is. So please tell us. Isaac, do you have any questions for us?
Oh.
Okay. I'd like to know what the fundamental vaccination scheme is and how often should apply the vaccines and what's the natural option for tick, fleas, and what do you think of internal deworming? Okay. The reason I wanted to go over this is because those are always the same questions, right? These are always the biggies. And they should be big questions for you, Monica. You should be wanting to take some time to look at these. These are a big deal. These are the kinds of things can really harm your animal, encumber them, encumber their vital force, their terrain. So there isn't, let's see, how could I put it this way? To me, less is always more, right? And less means literally sometimes none. Usually it means none. And the reason I say that is not because I'm flippant about it, because we as holistic practitioners, Jeff, you and I know this, we have other options. So you don't have to be like what I call going naked if you don't feel like that's safe for your animal. That's not necessary. For me, I'm a little bit more comfortable going naked for my animals because I think I have enough support because I know all the other kinds of things I've done for them. But some animals, or a community, wherever you live, whatever you think is your risk, their susceptibility, you have to look at that. But there's plenty of options for natural tick and flea control. I'm sure you have something, you have a blog probably on your website. I do. There's some great products out there that are completely natural. In terms of vaccinations, we over-vaccinate, period. There's nothing I can say nice about vaccines. And it doesn't matter. I can't say, they're just not that. We have And one of the things that we're going to talk about with Dr. Todd Cooney is he's on, I think, Sunday or Monday. I can't remember. Sorry. We're talking about homeopathic nosodes. Do you use them in your practice?
I don't actually. I've got them, but I rarely take them out except for, if a kennel requires kennel cough, we use the Bordetella nosode. Some kennels now will accept that, but the reason I don't use them a lot, and I'm glad that you brought this up, is the word that you mentioned that isn't in common parlance, and that is susceptibility, because that's kind of what it's all about. It's the more you improve the terrain, the lower your susceptibility to, a great example is 2 dogs go into the same kennel, they both get exposed to the exact same germ, kennel cough germ. One gets sick, one doesn't. The difference is the susceptibility of the one that gets sick versus the one that doesn't. And it may be the food they eat, it may be the interventions. A very common one that actually we've recognized is actually being not very happy and being suppressed a lot. So when the body tries to express a symptom and then you suppress that symptom, that may actually affect their susceptibility and make them more susceptible to the germs.
Yeah. And because the germs, they're really only opportunistic, don't you think? They're going to come in when you are susceptible, or they're already in the body. There's a lot of philosophy, and I actually think that really most of these things are in us. It depends on when, you may be exposed to something that you've never seen before, that would be very odd. But most everything we've been exposed to in our environment some way or another.
And the way I see it is that it's an interplay of 2 factors: individual susceptibility and the dose of whatever, whether it's a germ or a toxin, and that the higher the number of bacteria, no matter what your susceptibility, you're going to get sick, but you're going to get well pretty darn fast.
Yeah, yeah. So yeah, because you have to have that susceptibility first. That's the first thing. Okay. And is there oh, I know. I guess I answered most of that. Okay. Let's look at Maria's question. There's also a push to get pets on drugs and medical health insurance. This will ruin not only our, wait a minute, Isaac, I didn't hear it, not only our pets, but the practices of excellent vets. So, what I'd just like to say about insurance is, over the course of my career, and I'm sure yours too, Dr. Jeff, this has become very popular. It was not very popular, and there was no such thing as pet insurance years ago. But I think it's a sign of the sickness of our animals. And when you have to have insurance, because it can be financially devastating, $10, $20, $30, $40,000 for some of these treatments or surgeries, yeah, you better get insurance. If you're going to be feeding poor quality food, lots of vaccinations, lots of flea and tick, pesticides, et cetera, you better get insurance, because you're going to need it. Your animal's going to get really sick. And it's good that the insurance companies are out there to help people. I'm not saying that. It's just, you can spend your money if you need to. I personally would rather spend my money on good food and things. Now, I know one of our sponsors is an insurance company, and some of these insurance companies are fantastic. They pay for alternative care, which is really wonderful. I wish the human insurance I wish Medicare would pay for more alternative care, don't you? And right, but that's what, to me, it's just kind of a sign of what we need now, because the animals are not as healthy. They need more, and the medicine has gotten more sophisticated. So of course, it's more expensive. We have more specialists, which is wonderful, but it's also prohibitive for people. It's so crazy expensive to have a dog that needs even a dental with a specialist. So thank goodness we have them, but thank goodness there's some insurance too. I'm just saying that we have to look at, that's a fine edge. That's a, kind of, we have to look at what that means too. Okay.
I love that you like insurance, because I love insurance because of the expense of, just for what you said, the expense, and you can have all the diagnostic tests run and then decide what to do. And that is part of the mindful medical decision-making process, is collecting all the information, both holistic and conventional, and then deciding what to do.
Sure. Yeah, exactly. So you're right. It supports people that can afford it. It supports maybe more thorough investigations into medical care. And yeah, I mean, I'm very grateful for many of my clients because they're able to get a lot more done. So anyway,
for sure. Who's sponsoring? Yeah,
Embrace.
And they're I don't have them right here, but they're my favorite, and I just love the name.
Yeah, it is a good name.
And they do cover everything.
Yeah.
And they have a wellness policy, which even covers, other things.
Yeah. And cover, yeah, exactly. Let's see. What am I missing, Isaac? Let's see.
Oh, I was hoping that question would pop up.
You want to talk about that?
Sure. And the reason I was hoping it would pop up is the poster right behind me, which I don't know if you can see it, but that is the Hahnemann Monument in Washington, D.C.,
right,
which is the only monument to an MD in D.C. for the number of lives that homeopathy and energetic medicine and balance and terrain have saved over the past couple of 100 years. And, there's a quote that nobody should be dying from pneumonia. That's because the body has the ability to heal from pneumonia. So, I guess the answer to, are antibiotics always needed? I would have to say it depends. It depends on your inclinations. I mean, in my mind, I would say, no, not really. But, sometimes that's the right choice for you. And that goes back to Christine saying there is no wrong answer.
Yeah. But there are a lot of good options, that's for sure. And, I certainly would research that out first rather than last. I mean, if your animal is deathly ill, then you've got to do antibiotic. And they know for sure it's a bacterial pneumonia, because that's the thing. I mean, pneumonia by definition is bacterial. So it's not viral. They changed that definition with COVID because that was not ever the case. It was bacterial pneumonia. And the animal usually has, or the person, a fever, has sputum, has lungs that are filled up, the x-rays look a particular way. So in those cases, in extreme cases, your animal might need those antibiotics. If your animal has repeated pneumonias or bronchitis, this is a weakness that needs to be supported, don't you think? And, either with Chinese medicine, with acupuncture, with homeopathy, certainly nutritional therapeutics, anything that can, again, rebuild those tissues and help the overall immune system. But I'm not one to jump to them unless I really feel that the animal is, is really severely compromised.
And you said one thing, I think that is the only indication for antibiotics in pneumonia or any other acute disease, and that is they work very fast, and they work faster than the body's ability to heal itself sometimes, which works according to nature's timeline, not ours. And that's why, we're used to, well, if it's not helping in a day or two, then we got to switch drugs. But if there's an acute pneumonia or an acute, anything, and you want to reduce it right away, there is acute homeopathy, which works really well and faster than drugs. But that's also the place where drugs and antibiotics may very well come into play.
Okay. Yep. Great. Love it. Okay. What other question do you have? Should we give our dogs probiotics daily? Can we give them the probiotics that I take daily? I don't think so. I think that most of the probiotics have about 7 different strains in them, usually lactobacillus and bifidobacterium for if you're using your own human probiotics. And those are fine, but we have thousands and thousands and thousands of bacteria in our gut. So if you're just daily inoculating yourself with 7 different strains, those 7 strains are going to predominate. Not that they're bad, but they're going to predominate, and the other ones might take second fiddle, so to speak, and not create that balance, that harmony that you really need. So what I prefer, unless they've been on a lot of antibiotics, and you probably would say the same thing, right? Use them after that. But I really prefer prebiotics because that's the food to feed the probiotics. And then that way it's actually a little bit safer. But occasionally, if you feel like you want to do probiotics, I actually have them, especially lactobacillus, in one of my detox protocols, because something a lot of people don't know about is lactobacillus can actually grab a hold of some heavy metals and take them out the poop chute. So I like them when I'm doing a protocol like that for detox. So Jeff, do you have any comments on that?
The answer for me on probiotics every day or using your probiotics is it depends on the situation. Actually, I guess that's the answer to all the medical questions, really, is it depends on the context of the situation and the individual, because every pet, it's like they're like snowflakes. They're all different.
Mm-hmm. Yeah.
I do like probiotics for a lot of diseases, IBD and other, but usually rotations, so as to avoid the trap that Dr. D is talking about as far as relying on the same strains over and over again. And some do, contain different strains, but focusing on those what are called in some, like fluorophage is a probiotic multiplier. So it's actually a way of nourishing your own bacteria.
Is it a prebiotic? I don't know what that one is.
It's the fluorophage it's actually unique. It's a bacteriophage, I believe.
Oh, okay.
So yeah.
Okay. Oh, interesting.
So
What's
yeah,
it called? Fluorophage.
fluorophage.
Oh, interesting. Huh. I know about bacteriophage. That's interesting. I hadn't heard about that. So there's other ways. Again, what he's talking about here is plenty of fiber in your diet. I mean, if your animal will eat some fermented foods, I'm very cautious about fermented foods because they have a lot of histamine in them, and animals that have already a lot of histamine aggravations like skin, you have to be a little careful. But I think what Jeff is saying makes a lot of sense is, change the environment so the probiotics establish their own healthy balance. Right?
Yep.
Okay.
Exactly.
Okay. Good. Do we have any other questions, Isaac? Susan says, when working with homeopathy, can you use an acute treatment while a pup is on a deep chronic remedy? You want to answer that?
Sure, and I think you know what I'm going to say, that
Yeah.
it depends on the whole situation, but usually, yeah. Usually you can. If your pup is on a chronic remedy and injures itself or has a bee bite, or then you can definitely reach for the arnica or apis or other acute remedy. But it's a real good idea in that situation to be under the care, of a vet homeopath.
Yeah. And I would even go a little bit further to say, this is also what we can call acute manifestations of chronic disease. If it isn't like a bite or some accident, it could actually be something coming to the surface that has been latent or even suppressed. And right. And then it comes to the surface, and you just don't want the animal to be miserable. So you can treat that knowing that you're going to go back to their remedy, what we call a fundamental or constitutional remedy. So yeah, you can do that. I'm not quite sure, what Susan was referring to, but yeah, either way, you just have to be cautious and kind of know what you're doing, follow it through.
And if there's no obvious trigger, then there's good clinical evidence that up to 50% of the acute manifestations are actually a manifestation of the underlying disease, and the remedy that you give the acute may actually help both the acute and the chronic.
Yep, there you go. Yeah, that's beautiful, isn't it? It's just, it's such an amazing. I hope you all know that we are classical homeopaths. So the way we talk about things is through the eye of a homeopath. And I'm interviewing Dr. Richard Pitcairn. I think he's on Sunday or Monday. I'm sorry, I'm getting everybody mixed up when they're there.
Yeah.
And we talk extensively about homeopathy. And if any of you have any doubts about it at all, it's one of the most wonderful medicines for animals. There is no placebo effect, so you're not making up if they're responding to these little magic pills. And it's just wonderful to watch the response, often very quickly to medicines, to avoid, all kinds of those medical traumas that end up costing you a lot of money that you have to submit to insurance, or, there's so much you can do yourself. And that's my goal, to keep helping people, and yours too.
And that is right there. The essence right now is what you're doing. And again, kudos for doing this. You are empowering pet parents to basically take their pets' health proactively into their own hands and giving them the tools and the framework to do that with. So thank you.
It's a team effort. That's why you're here. Okay, Isaac, any other questions? Heather asks, question on nutrition. If lightly cooking the proteins instead of raw feeding, what's the best way to ensure the dog is getting the appropriate calcium phosphate ratio from where? Bone meal seems to be one of those hot topics. I think so. I mean, if you're, so the issue, first off, we're talking about lightly cooking and then instead of raw feeding. Lightly cooking to me is a must for many animals. Not every animal can eat raw food. Many young animals can, and it's totally fine. I have a 17-year-old dog. She's on the picture that I'm kind of holding her. She's 17 now, and she's not perfect by any means, but I started feeding her a couple of years ago, cooked food, lightly cooked, and she just loves it. But she loved her raw food before, but I could tell now that she kind of needed that, and I think energetically she needed it. But what was the other part of that question? Sorry. Calcium phosphorus ratio. Do you want to talk about that a little bit? I can.
I usually don't focus on the ratio as much as that pretty much every recipe that doesn't have ground up bone in it requires calcium because muscle meat in particular has a high level of phosphorus, and the body does need to balance out the calcium and phosphorus. But like us, we don't worry about balancing out our meals. It's all variety. But sometimes if we're focusing on a diet, we're not giving that much variety. So you can add, my favorites are eggshell
Mine
calcium
too. Mm-hmm.
and seaweed calcium. The vegans among us, we use seaweed calcium.
And I think, for me, the no is bone meal. And the reason I say that is the contamination of commercial cattle in particular in this country, or if you're just using, big ag animals, very high pollutants of heavy metals, arsenic, mercury, even lead. And even if the bone meal comes from out of the country, often New Zealand, they got plenty of problems there too. Maybe it's a little bit cleaner, but I tend to stay away from bone meal. I have for decades. So I think what Jeff is saying, a really good source is organic eggshells, and you just let them dry or toast them if you need to a little bit. I put them in a bowl in my oven. I have an oven, and when I crack eggs and rinse them out and I put those in there, when it kind of fills up, then I put everything in the blender and I've got ground eggshell. And I put about a teaspoon of that per pound of meat. And that's a really safe way if you're not feeding bones. Now, if you're feeding things like turkey necks or chicken necks, which are great for the teeth, they're great because they break down easily raw. Now, I mean raw. And they're great because they're loaded with cartilage, and they're great for all that doggy entertainment. That's a great way to get calcium too. So again, if they're clean sources. So anyway, did we cover that one? I think we did.
And that is kind of the essence of it all, isn't it? Food-wise, it's got to be a clean source. It's got to be a source that is free of glyphosate and GMOs and contamination and majority of foods that are commercially available. I mean, we know in people there's a direct link or a direct relationship between the more of that food that you eat, the higher your rate of cancer.
Exactly. Okay, Isaac, anything else? I'd like to know if it holds true or ever held true that spaying and neutering really prevents reproductive cancer. Well, that's exactly one of the reasons I have Dr. Tara Timpson. She's on Sunday, and you definitely want to pay attention to that, JFL. It's a eye-opening conversation, and Tara's a dear friend of mine that works at Best Friends Animal Sanctuary in Utah. And of the millions of animals that go through their facility, they, how can I say, she's become an expert in doing the ovary sparing spay for dogs and vasectomies. So our conversation, of course, was centered around that and the studies that came out of Davis. And there was a study 20 years ago looking at golden retrievers. You remember this, Jeff? Excuse me. That showed that the incidence, and I have a blog about this, I don't know if you do, Jeff, but it showed that the incidence of pretty much what we thought was true wasn't. That actually early spay and neutering was harming the animals, was causing more susceptibility to cruciate repairs and hip dysplasias and even cancers. And then they did a 20-year follow-up, and you can get this study online. I can't remember the name of the website, but it's University of California, Davis, and you can look up golden retriever 20-year perspective. I don't even know what it would say, probably spaying and neutering, I think something like that. And so anyway, we had a great conversation about that. There's lots of good information in there. So I'm not a proponent of that. I like to wait at least till the long bones close. The long bones at the ends of our bones, there's a growth plate that has to close. And for some of the large dogs, they don't close till about 3 years, something like that, right, Jeff? And
Yeah.
but what I love is keeping these animals intact. Not only helps the development of their bones, but it also helps the development of the brain, because hormones soak our brain. The female hormones allow for the female brain to develop, and the male hormones allow for the male brain. So if you want a perpetual puppy, spay them early. They're never going to be as healthy as you like. But if you want the healthiest, most robust animal, then definitely let them keep their gonads intact, or do the ovary sparing spay or the vasectomy. And again, we don't want to go into that in detail because Tara and I went into it, but it's pretty fascinating when you think about it. There's just so many wonderful options. The other one point, let me just say, and then I'll see what comments you have. And I've done a fair amount of research on this. When the hormones come into like maximum fruition, right at about puberty, they supercharge the immune system. Because if you think about it, if the immune system wasn't intact when a wild dog was 6 months old, they couldn't procreate, and they wouldn't be able to have a decent immune system to basically be out there in the world. They would still be like humans, dependent on their parents. And that's not the way the world is for our dogs and cats in the wild. So it's in my mind, it's critical for the development of all kinds of things, their muscles, their bones. I have an intact male cat right now. He's about 9 months old, and I'm trying to see how long we can go. I've talked to him. If he has bad behavior, we're going to do something. But because he is so robust and is just continues to develop, and I can tell that his little brain is getting smarter as he's learning how to hunt mice. And
Awesome.
Anyway, Jeff, what do you have to say about that question?
Well, I concur with everything you said, and I guess the proof is in the pudding, in that our animals are all rescues, but the female kitty, and female cats can come to heat every couple weeks. It's the only one that we got a number of years ago unspayed, and she's still unspayed.
Cool.
12 years of age.
Awesome. Very good. I love to hear this. See, we don't even think it's possible, because the mentality now is you got to do it. You got to do it. Now, I'm not talking about, oh my gosh, we're going to go down this slippery slope, aren't we, with animals that are rescued? Because all my animals have always been rescued, and they've all been spayed and neutered way too early. My 17-year-old she went through 3 shelters. She was done at 5 months.
Yeah.
So, and she's still 17. That's pretty good. And been robust most of her life. So, but she never had any other things done to her either. So this is something we have to really look at. And that's what Dr. Tara and I talked about, the health compromises. She told me once, I wish I had taken pictures of all the animals that were spayed early or neutered early, and then taken pictures of them at 1 year and 2 year, and the difference in the animals that have kept their resources longer. And remember, if you elect to do anything like a ovary sparing spay or a vasectomy, you can always undo it. You can always do another surgery if it's not working. If you don't like the fact that they still get a enlarged vulva, or the males still think that they're hot tamales, you can always, they're not going to get anybody pregnant, but you can always do the surgery. The other way around doesn't work. So I don't know about you women out there, but I'm going to date myself. Going through menopause, I wish I had a few more hormones. Maybe not all of them, but those hormones are important. They're really critical. So keep them as long as you can. Don't just do something blatant just because everybody's doing it. Just really watch your animal. Pay attention. In other countries, they don't even think about neutering their animals. And I mean, these are owned animals. These aren't just animals on the street. These are people, care for these, and they never think about removing their gonads. This is a cultural thing here. Anyway,
And
Okay.
that's actually where I was going to go with Dr. Sarah Fox-Chapman studied homeopathy over in the UK. They do not, I mean, she
Yep.
did a fabulous spay and neuter course that looks at all these options, but like you just said, they do not even consider, gonadectomy over there.
Yeah. No. Why? Why would you do that? They look at us going, oh my God, why would you do that to your animal? Okay. Next question. We got a few minutes left. Would you supplement with a prebiotic or give it through food? Both. You can do both. There are prebiotics you can get. I like prebiotic by Garden of Life. Has organic prebiotic, doctor formulated prebiotic. I like that one. It's a non-flavored. You just have to go really slow because sometimes when you introduce these things like inulin and even a little bit of psyllium, these foods, they can cause a little bit of diarrhea. So you just go a little slow.
And there it is.
Should colostrum be given to a dog on an empty stomach in bone broth? Do you have a comment about that, Jeff?
I don't. We use it, empty stomach and in food, but
Yeah, any way you want. It's safe. Just get high quality. Yeah. Okay, next. Donna says, what's your opinion on the safety or not of microchipping? Is there research you can point that either support it or show detrimental effects of microchipping? Do you know that one? Do you know if there's research?
well, I would say hi, Donna. It's great to have you here,
Oh, that's Donna. Yes.
and
I didn't notice that.
thank you, for asking. And no, I'm not aware of any good research, but I know there's tons of anecdotal evidence that that anything foreign introduced into the body can be problematic. And the best example might be the jabs that we know are directly associated with cancer in cats. Even when they did jabs without vaccination, they could get an inflammatory disease that leads to or increases the chance of cancer. But when it comes to introducing any foreign anything in the body, I'm not a fan, and I'm not aware of any research because who would fund that kind of research?
Yeah, exactly. True. Good point. Years ago, do you remember when these were lead?
But yeah,
That was scary because they were like little lead pills injected into the body. And they do often, now they're glass now, as far as I know, every one of them is glass, but they can migrate. I agree. I've seen foreign body masses happen around them. So I'm not a big proponent. And a lot of this is management of your animal,
right, right, right.
All right. Next, Isaac. I think a lot of tear staining is in these little dogs, little white dogs. It can be blockages of those lacrimal ducts. They're the little ducts on the inside of the eyes. It can be blockages in there. So you can use some herbal preparations that have euphrasia in them to kind of help clear, and even echinacea to help kind of clear those tear ducts. And the other thing is get them off chicken. Get them on a cleaner food. What do you think?
I guess the only thing I would add is that normal tear staining in a small dog or any dog is evidence that things are is often evidence that things are at a balance. I'd say in my practice, 3/4 have gone to the ophthalmologist who's checked the patency, whether the tear ducts were open, and that was not a problem. The problem lied in the fact they were overproducing tears. And that does resolve with homeopathy and with all energetic. As they improve their balance, their tear
Mhm.
staining and their tearing goes away.
That's right. That's right. And I always change the diet too. Okay. What else? Fiona asks, would you recommend dental cleanings and how to prevent tartar? If I detox it from anesthesia, what do you recommend? Well, yeah, I mean, it kind of depends. Dental cleaning, if it's necessary. It's kind of become a big thing for every veterinary practice to push the dental cleanings, maybe a little too judiciously. But, if they're accumulating tartar and they're a healthy animal, we might want to, again, relook at the diet. That's kind of the first place I start. But Jeff, you have anything to say on that? We can talk about anesthesia next.
Yeah, just said the dental issues are almost always preventable with, raw bones, edible bones, and even if the tartar is already built up, chicken necks and turkey necks work real well, but you may have to hold them right where the tartar is building up. And there's a product from New Zealand, regenerative product for oral spray that actually can help as well. And that is New Zealand deer velvet products.
Yeah, Dr. Judy Morgan has a product too. We'll plug her products too. There's a number of products out there. There's one by Animal Essentials, and it's a version of Plaque Off, but theirs is quite a bit cheaper, and it's it's a kelp-based product. Have you used those, Jeff? They can work.
I used to use Plaque Off until I discovered the raw paws version of a kelp, which is the exact same species. So you get it for about a fifth or less of the price.
Yeah.
A big bag for the same price as that little jar.
Oh gosh. And then and Animal Essentials again, who's one of our speakers. I like their product, but it's an interesting story about that. That I understand that originally the Japanese scientists figured this out, and some of the observant scientists noticed that there were no barnacles on the boats that were moored in a certain area with kelp of a certain kind. Yeah. And then they said, oh, that's interesting. Why do those boats not have any barnacles? And so then they started experimenting, and then it became actually human products. And then from there, they, used it. And you can just put that in the food. It's easy to put, most dogs tolerate it. It smells very fishy. So some dogs may not, or cats may not go for it. But it can be quite effective at removing, softening, all of that. So when you think about it, barnacles have a lot of calcium because that's how they adhere to the boat, which is very much what's happening, in the dentition. So that's one of the first things. And I agree with you. The healthy bones that they can sink their teeth into is the easiest. I've seen many dogs where I've told for a week, I said, you got to give these bones this size, whatever, depending on the size of the animal. A week later, the tartar is gone. So there's a lot of different things you can do besides just, there's also non-anesthesia dentistry if your community has it, and if your animal is a candidate for it. It's a great way to remove bulk tartar and also polish, but it's not like extensive. They don't do x-rays, they can't do any extractions. So depends on, your animal, and, but it's a great way, especially if you need to do it often. But again, that's a sign of chronic disease. So hopefully doing some deeper internal treatments, will help slow that down or stop it. Anyway, anesthesia. Okay, let's just talk about that real quick. I have a whole protocol, but basically I use homeopathic phosphorus after anesthesia. Do you, Jeff?
Sometimes, but I will frequently use detox in the form of a fiber. I was on a human detox seminar. After going through all the supplements, it said none of them really work as well as fiber, which does what you mentioned about the lactobacillus as far as latching onto the toxins and letting it go out in the poop.
Cool. Okay, good. Okay, Isaac. Did you find another question?
I have seen a lot, but I think that Isaac may be saying it's almost time to go. Oh, wait.
Aromatherapy. Hi, Bill. Oh yeah, you mean for anesthesia? Yeah. I mean, I always use phosphorus because I noticed that, I mean, it's indicated in the homeopathic literature that phosphorus is good for anesthesia. There's other remedies as well, but that's an easy one for people to get at the health food store. And a lot of times after you give phosphorus, you can actually smell the anesthesia on their breath. It also will help with nausea post anesthesia. And if that doesn't work, I tell people to use Nux vomica because that's a kind of a universal solvent. So anyway, okay.
And I'd say, hi, Grandpa Bill. Thank you for your question. And yeah, essential oil is a great suggestion.
Yeah. I'm sorry, I didn't see that. All right. Sophia says, how can I transition my dog from pharmaceuticals to a holistic approach? And excuse me. A neurologist suggests that my dog may have idiopathic epilepsy. Oh, that's a good question. It's a little complicated. It's not something we probably could go to in too much detail because you have to do this very carefully. You can't just take them off Keppra or phenobarbital or zonisamide, whatever they're on. You cannot do that quickly. They have to be supported. And my patients, I always have them on nutraceuticals to support, the health of the brain. And one of our speakers is Dr. Susan Wagner, and she's a good friend of yours. And she was on, and we were talking about, we didn't talk much about seizures or anything like that, but we talked about CBD because she's quite knowledgeable about CBD. So that would be my first place to go, is to work with somebody who's really familiar with CBD, a veterinarian who can help manage all of that. And because CBD and CBG has some really good benefits for helping control epilepsy and slowly lowering drugs.
For sure. And if your pup was just tentatively diagnosed, it may not even be on drugs yet. So yeah, now's the time to do that transition that you implied. And how do you do it? You do it in one day. You go from, you consult with a holistic or homeopathic vet, and they will walk you through whatever has to be done, whatever is indicated.
Yeah, absolutely. It doesn't have to be a long process, but you need help. You can't do it on your own. That's something I was going to say. I forgot it now. It's gone. It's all right. Okay, Isaac. Pet summits. Could you advise me on what to do with the dog who needs a detox? Jessica, that is definitely an area that's kind of one of my specialties. Probably my biggest one. I've spent a lot of years sort of studying that whole, those mechanisms and what animals are toxic to. I wish we had more ability, like in humans, to test for many of the toxicants that are out there, but I study with human practitioners on environmental health. So I'm pretty familiar with that kind of thing. Let me just say, it's a slow process. You can't do it quick. It's not the kind of thing you can want to do, taking your dog down to the vet for IVs and you don't have to do that. The body knows how to detox. So if you just support the body will do it slowly over time. And I support it. If I'm working with a particular client, I support it with homeopathy, but I always support it with basic nutritional therapeutics, supplements. Excuse me. Sorry, guys. I'll be probably talking too long. And those are particularly, I target where I think the body needs the most detox. And usually it's liver and kidney. Because those are the mechanisms for excreting toxins besides the skin. There's 3 big ways, So I can't go into a whole lot more detail, but in the next summit, Dr. Odette Suter is going to be hosting a detox summit, and I'm going to be doing a presentation on there. So make sure to stay tuned for that. And I also will have a bunch more protocols on my new website very soon.
Oh, that's exciting.
Anyway, yeah. So we can take another question or two. So, and we're really sorry if we didn't get to your question today, but we'll try to come back. We've got 3 more days. Okay. Anything else, Isaac, we've got right now? We've got this little guy behind the scene. He's behind this curtain, and his name is Isaac, and he's doing all the magic back there. Hi, Isaac. Okay. Susan says, do dogs digest bones if they swallow chunks? My pup is 45 pounds, but doesn't chew things down to small sizes. I'm afraid to give bones. Okay, Jeff, you can take that one. I'll rest my voice.
Well, any bone question, I'd refer back to the Dr. Tom Lonsdale, who's the expert in bones. He's got the little book, Raw Meaty Bones.
Raw Meaty Bones,
and a dental book, because he said in his practice of many decades, if the dogs are eating raw bones, they don't get dental problems. And in your situation, I would say actually the bigger the better. Not a recreational bone, but certainly, do they digest? The answer to do they digest is it depends on your dog and its digestive ability, strength of stomach acids, intestinal health, immune system. I wouldn't be overly concerned unless there are gulpers. If your dog is likely to bite the bone in half and swallow half, yeah, then you've got the risk of obstruction, and they may actually have symptoms even before the body does the job of digesting the bone.
Yeah. Wolves in the wild eat a lot of bones, of course, and they puke them up all the time. So I've seen many of my clients' animals puke up pieces of bones. It's usually, small pieces. You just want to make sure they're not cooked. We definitely want raw. Do you remember? I mean, it used to be 30 years ago, you could get like big knuckle bones that had a lot of meat and cartilage on them because they were hand cleaned. And now everything's done by machine. And so it's really hard to find those bones unless you have a local butcher. It's really hard to find those great bones that are a great source of entertainment, and the dog can kind of chew on the side as well. So if you can, good for you, because you can at least, that's awesome. But always think about, getting a little bit larger than you might think, but watch your animals all the time. You do not want to give a bone and then just let them go. It doesn't matter what kind of a bone, a marrow bone, a turkey neck, anything. You just want to make sure that they're there in the kitchen with you. Put down a towel, a beach towel, or, be in the backyard with them while you're drinking your coffee, whatever, because it's important, and after a while you learn you can trust them more. They're not so goofy about it, but especially when dogs are starting out, sometimes they get a little aggressive. Right.
Well, they're super psyched to get something that they have been waiting for all their lives.
Yep, exactly.
Kind of like the transition from commercial to fresh food.
Yeah.
How many picky eaters are thrilled when you go to a partially cooked or even raw food diet?
Oh yeah. Oh my God. Well, I think we better wind this down now. And I'm really sorry if we didn't get to your questions, but please post them in the Facebook group. We'll try to get to them there. And we're here again tomorrow, but at a different time. So it's 3:00 Eastern. We'll be answering questions again. So yeah, and then on Sunday, it'll also be 3:00 Eastern. And then on Monday, it's, I don't know, it's on there, but I think it's 6 o'clock Eastern. Yeah, 6 o'clock Eastern. Yeah. So it's been a pleasure being with you, Dr. Jeff, as always. Thank you for helping me, especially with my throat and lame throat. But it's always fun listening to other practitioners. Their ideas are always help me. And thank you all for being here and watching the Holistic Dog Summit. And just remember, you can still tell people about it. We've got 3 days left and plenty, and they can view for 48 hours. So anyway, it's a good deal, isn't it? Free.
Free is a good price. And thank you, Dr. D, for doing this. It's been just incredible. And yeah, I mean, thank you. We're all so grateful for your time, and thank you all for coming. And we're very grateful for your time and that you want to work with your dog's bodies, pets' bodies the way you are.
Absolutely. Yes, you're on the right track. Hang in there. That doesn't come all in one night. Didn't for us. So just hang in there little by little. Be patient with yourself. Oh, I want to just give you a really quick kind of load down if I can. So tomorrow is about day 2 is the human-animal bonds. I'm interviewing Dr. Isla Fishburne. She is a lovely gal from the UK, and that interview was spellbinding to me because I'm very familiar with shamanic practices, but she did something that was just such a treat. It just kind of took over me. So you definitely want to listen to that. And then I'm interviewing Dr. Susan Wagner, and I know she's a good friend of yours, Jeff, and she's an absolute delight. She's a veterinary neurologist, board certified. The whole thing was on the staff at Ohio State, I believe. And she does healing touch. And we talked a lot about these oscillating vibrations, these Tesla oscillations. So that was, and then we talked, of course, about CBD, phytocannabinoids, and animals as mirrors. And then this is a new friend, but you have heard his name, Dr. Mark Beckhoff. He's authored 31 books. And when I emailed him to see if he would talk with us about dogs, because he is an incredible source of information. He studied, he's an animal behaviorist basically and cognitive ethologist. And when I interviewed him, when I asked him if he'd come, he just said yes. I was just so delighted. Like he's just a rock star in the world of ethology. And the interview was quite good. It was he's got this new book called Imagining the Lives of Dogs in a World Without Humans. And I read it. It's fascinating. I mean, it is an interesting study, but you'll really love that interview. He's a hoot. And then my dear friend, Dr. Cheryl Swartz, I've known her for decades. She was one of my first teachers in acupuncture and is still one of my dear role models, if I could say. She also taught me a fair amount about using medicine in therapy, more Chinese medicine for food therapy. So anyway, Cheryl's on with me, and she does this. She's big into Qigong, and so she showed us a technique for helping the animals. Anyway, and then my dear friend Rita Hogan, she is a dear. I'm just having so much fun with this. Doing these interviews was just such a delight because it was like coming together with your best friends. I just want everybody to be together in one room and have a party. And anyway, Rita's a dear. She's a herbal clinician, and she is a canine herbalist. And her therapies are uniquely different from most other herbalists. Her teacher is someone I'd studied with, and he's a wonderful herbalist. And basically, Jeff, you maybe didn't know this, her original teacher, Matthew Wood, is also very educated in homeopathy. So the classes with him kind of morph between homeopathy and herbalism, and it's just beautiful. You know, she does the same thing too. So it's kind of a completely different approach. So tomorrow's a lot of fun. I hope you all enjoy tomorrow's interviews, and more to come. 2 more days after that.
Awesome.
Yay!
Awesome.
All right, Jeff. Thank you. Bless you.
You, Doc-
And good night to everyone. It's been a
Thank
pleasure.
you all. Bye.
Okay. Good night.